Well, to the extent that there's a lot of discussion about the failure of the governor to take the Medicaid money that's resulted from the Affordable Care Act, and that's the first thing that we've got to do. I've said consistently since this campaign began, or I guess earlier this year when we started talking about these issues publicly, that one of the first things I'm going to do is appoint a task force. And a task force is not a study committee. It's not something that goes on forever. It has a task, and it's in a particular period of time going to accomplish that task and issue a report. And I want that task force to consist of people in the medical community just like you, Dr. Roseman, who understand this, who will be a part of a group from within the Department of Health and Hospitals that administers the Medicaid program for Louisiana and handles all the responsibilities for health care delivery by the state, from the medical education community because it's so closely entwined with the delivery of health care to the indigents, and from the private sector, health experts, all from Louisiana. I don't want to bring in anybody from elsewhere. I want Louisianians to sit around a table like this in very short order, develop a series of recommendations to be presented to me to apply for a waiver from CMS to accept those Medicaid dollars. I don't want to take them under the exact current rules that are in place right now without a waiver. But I do want to create a waiver that would justify Louisiana taking the tax dollars that we're sending to Washington anyway and not getting back to provide care for the indigent. It's got to do two things. It's got to, number one, protect Louisiana on the back end if the feds change the rules as they're prone to do and do not continue to provide the funding that they've provided in the past. And secondly, and perhaps more importantly, provides Louisiana with the flexibility to use those Medicaid dollars in the way that we believe is most appropriate to deliver the kind of health care to Louisiana's indigent population that makes sense and that provides good results for those indigent patients and also is cost effective for Louisiana. As I said earlier, we are in the infancy of this new health care delivery system in Louisiana, these public-private partnerships in various different relationships across the state. And all of them, to some extent, are involved, obviously, in providing care to the indigent. And by the way, we have to care for the uninsured no matter what when they show up in an emergency room. It's not like we ignore them. To the extent that we could move more uninsured to Medicaid and have the dollars necessary to provide the treatment for them and hopefully the preventive care from them to avoid going to the emergency room for things that could be handled in a preventive care situation if they just had a doctor or somebody they knew they would go to, had a clinic that was reasonably accessible to them. Those are the kind of things we got to be talking about, and that's how we need to use those dollars to craft a waiver that gives Louisiana the flexibility to respond to the needs that exist under this new relationship.